the pelvis, it's going to be responsible for posteriorly tilting the pelvis. It's also going to be responsible for contralateral rotation, so rotation to the opposite side. At the hip, it's going to be responsible for extension of the hip, lateral rotation of the hip, and then it's also going to be responsible for both abduction and adduction. Hey everyone, Steven here from Team Euphoric, and this week's YouTube shorts are dedicated to Sir Mix-a-Lot's favorite muscle, and that is the gluteus maximus muscle. The gluteus maximus muscle is the most powerful hip extensor in the body, which makes it very, very important, and it's going to be very, very taut and very, very weak in a lot of people, which could lead to things like low back pain, hip pain, knee pain, and also postural dysfunction. When it comes to posture, most people are going to have excessive anteversion of the pelvis or anteriorly tilted pelvis. Ideally, for men, you want a 4 to 7 degree anterior pelvic tilt, and for women, you want a 7 to 11 degree anterior pelvic tilt. The problem is that most people are going to go far beyond that range, and the gluteus maximus muscle is responsible for posteriorly tilting the pelvis. So if you want to correct that dysfunction and alleviate symptoms of low back, hip, and knee pain, what you can do is strengthen the gluteus maximus muscle. With regard to the glute max, some important bony landmarks are going to be the pelvis. With regard to the pelvis, this is your pelvis right over here. Specifically, it's referred to as the ilium. You have a right and a left ilium. The top portion of the ilium, is referred to as the iliac crest. Then, next to the iliac crest, at the center, we have the sacrum. The sacrum being this upside down triangle at the bottom of the lumbar spine. Then, at the bottom of the sacrum, we have the coccyx, or your tailbone. From there, if we were to go at the bottom of the ilium, we have the ischial tuberosities, or your sit bones. Then, if we look at the femur, this is your femur right over here. Your greater trochanter is on the lateral aspect of the femur, and then posterolaterally on the femur is going to be your gluteal tuberosity just below the greater trochanter. And those are just some of the important bony landmarks when discussing the gluteus maximus. Your glute max attaches at the posterior iliac crest, the posterolateral sacrum, your coccyx, and then it inserts into the iliotibial band via the gluteal tuberosity. It also has some fascial links at the thoracolumbar fascia and the sacrotuberous ligament. And because it crosses the pelvis and the femur from posteriorly and from medial to lateral, at the pelvis it's going to be responsible for posteriorly tilting the pelvis. It's also going to be responsible for contralateral rotation, so rotation to the opposite side. At the hip, it's going to be responsible for extension of the hip, lateral rotation of the hip, and then it's also going to be responsible for both abduction and adduction. The superior fibers, because it crosses above the joint line, are going to be responsible for abduction of the femur, and then the inferior fibers are going to be responsible for adduction of the femur. And because it inserts into the iliotibial band, which crosses anterolaterally on the tibia, it's also going to be responsible for extension of the knee. But that is the muscular anatomy of the gluteus maximus muscle. Your glute max is innervated by the inferior gluteal nerve, or your L5, S1, and S2 nerve roots. I'm just going to remove the sacrum so you can see it. These yellow things right over here, those are your nerves, and then your L5, S1, and S2, those are the nerve roots that supply the blood and oxygen to your gluteus maximus muscle. The reason this is very, very important is because if you have any type of dysfunction to those nerve roots, or something like compression, that could shut off the function of your gluteus maximus muscle. So what you can do is some Eldoa exercises to help create space and open up space and allow for optimal function of the nerve roots in that area. Today I'm going to be demonstrating 4 strengthening exercises for your gluteus maximus muscle, and they're all a variation of the supine hip extension. From lateral to medial, we're going to be focusing on the lateral fibers, the medial lateral fibers, the medial lateral fibers, and the medial fibers. For each of them, you want to be laying down on your back, retroversion of pelvis, flat lumbar spine, flat thoracic, chin tucked in, crown of the head up, eyes looking down between your thighs to put the dura mater under tension. Your arms are at the level of the glenohumeral angle, and then for the lateral fibers, we want our knees together, feet apart. For the medial lateral fibers, we want feet together, knees together. For the medial lateral fibers, feet apart, knees apart. And for the medial fibers, we want feet together and knees apart as far as possible without letting the navicular leave the ground. For the actual execution, we want to go one vertebrae at a time and roll and unroll the spine, and then on the way down, we want to go as low as we can without letting the glute touch the ground, and then go back into hip extension without losing that retroversion of the pelvis. But that were the 4 strengthening exercises for the gluteus maximus muscle. Today I'm going to be demonstrating 2 myofascial stretching exercises for the deep fibers of the gluteus maximus muscle, and for each of them we're going to be in a supine position. This first one is specifically for the anterolateral fibers. For it, we want to flex the hip above 90 degrees to reverse the action of the glute. Then we're going to bring the leg into adduction by wrapping it around, grab a hold of the tibia. At the ankles, we want to go into dorsiflexion and eversion, and then at the pelvis, we want to go into anteversion of the pelvis without going into extension of the lumbar spine by driving the coccyx down into the ground and the ischial tuberosities away from our body. At the lumbar spine, flat lumbar, flat thoracic, chin tucked in, crown of the head way, eyes looking down at the floor to put the dura mater under tension. And this is the myofascial stretching exercise for the anterolateral fibers. And then if we want to target the posteromedial fibers, we're going to go into abduction. So we're bringing the ankle over the knee, grabbing the hold of our hamstring, and then we're going to push the knee away from our body. And that was the myofascial stretching exercise specifically for the posteromedial fibers. Today I'm going to be demonstrating two Eldoa exercises for the gluteus maximus muscle, and this first one is going to be the S1, S2 Eldoa. For it, you're going to be laying down on your back. Your S2 is pushing down into the ground. Your shoulders are elevated, chin tucked in, crown of the head away, eyes looking down at the floor to put the dura mater under tension. With your arms, you're going to flex your hips and knees. You're dorsiflexing and everting your ankles. Take your arms, grab them around the tibia, and then you want to unroll your spine until the base of the skull. As soon as the base of your skull touches, you want to lift your S2 up off the ground and press your S1 down into the ground. Your coccyx are pushing away, and then you're activating the buccolaryngeal fascia by swallowing and letting your tongue stick up against the roof of your mouth. And this is the S1, S2 Eldoa. Then, for the L5, S1 Eldoa, you want to go up against the wall, maximum extension of knees. You want to go into pseudo-inversion by dorsiflexion of ankles, inversion of ankles, maximum medial rotation of the femurs. At the lumbar spine, flat lumbar, flat thoracic, chin tucked in, crown of the head away, eyes looking down at the floor to put the dura mater under tension, retroversion and pelvis, maximum extension of elbow and wrist, maximum external rotation, and then flex arms to the level of the coronal plane. And those were the Eldoa exercises for the gluteus maximus muscle.